The coronavirus pandemic rapidly changing day by day and really even state by state. It is our mission to keep you updated on the latest information about COVID-19. Joining us yet again, Dr. Gary Berner with the Community Clinic of Northwest Arkansas. Dr. Berner, you said it's been a busy day for you.
It's been busy. It's been busy. Good but busy.
Well, we appreciate you taking the time to be here with us. President Donald Trump has released a three-part plan on when the country can begin reopening. Some states could begin removing certain restrictions as early as today. Do you have any concerns about this?
So, I think my main concern is just making sure that we're careful in how we reopen the state. I think I haven't been able to break down all the pieces, but I do know that he's giving a lot of jurisdiction and power to the individual states. And I think that's really important. As we've seen, Arkansas has had a much different impact from coronavirus than, say, New York. And so it really would not be, appropriate to treat those two states the same. It's been a completely different environment. So I think that's really important. And as I know, Governor Hutchinson and the Arkansas Department of Health will, of course, they're just going to take that with a lot of care. Really take the data, really look at individual areas of the state to then start to give their direction in terms of how different pieces can begin to open up, what that looks like, a week here, 3 weeks here, or a month out.
Yeah, well, let's take a look at phase one of the president's plan. It includes much of the current social distancing measures we're already following now, but it does allow places like restaurants, churches, and even sports venues to, quote, operate under strict physical distancing protocols. Governor Asa Hutchinson expecting Arkansas will be ready for this phase come May 4th. Do you think we'll be ready by then?
They have so much more data to look at than I do. I really wouldn't feel comfortable speaking too much against Governor Hutchinson's recommendation, just because they're able to look at such statewide data. And even with that, a sporting event with social distancing, Donald W. Reynolds, 70,000 people in tight spaces, what does that mean there versus a youth soccer game where it would be much, much easier to have that type of distancing. So I think, the devil will be in the details here in terms of how they lay out, even more specifically than those ground rules, how they'll play this all out.
Yeah, and I think that's a good point. And kind of referencing our interview yesterday, you had mentioned that things in 2020 might not look like they did in 2019. So I guess that still is to be continued. Now, I wanted to ask you, what fears do you have, if any of our neighboring states do lessen their restrictions before we do here in Arkansas?
Yeah, if neighboring states do that and then see a second peak, see a second rise in cases because of increased infections, then that would absolutely impact Arkansas. There's so much travel in between the major cities, Little Rock to Memphis, Little Rock to Dallas, Northwest Arkansas to the Dallas-Fort Worth area, Tulsa to Northwest Arkansas and Springfield. So, that much travel in between the different areas could absolutely impact. And then we'd then obviously be at risk for an increase in infections if those other states saw that.
Now, Arkansas, we're reporting a lower number of positive cases and deaths when we compare it to several other states, but some are thinking this is because we aren't testing as many people as quickly as we need to be. How can we be sure we are ready to begin reopening if we truly don't have a grasp on how many people here are really battling the sickness?
I haven't seen an updated report on, the number of tests that we've done compared to projections in several days. But I believe it was last week that, the governor and Nate Smith had mentioned that they did feel like we were, maybe even ahead of schedule in terms of the amount of tests that we had done. So I think that's encouraging that we're, kind of keeping up. That is a scary thing. Do we not have high numbers because we're not testing? And we know that we don't have enough tests just to ubiquitously test everyone. So that is something that we really need to keep track of. I unfortunately haven't seen the latest numbers to see how we're doing there, but the last I had heard, we were really doing, a pretty good job in getting those tests done.
Sure. Well, I hear from a lot of our viewers just how happy they are with how the governor is handling this situation. You know, a lot of other people have been writing to us on Facebook worrying that we aren't hearing the most up-to-date information. So that's why I'm asking you that question. All right. Thank you so much for joining us. I know you're busy, so I'll let you get back to your day, but I appreciate your expertise as always, Dr. Berner.
Yeah, thanks, Chelsea. Y'all have a good day.